If you have been told you have sciatica, chances are no one actually explained what that really means. Most people hear the word, feel pain shooting down their leg, and are immediately told they need medication or surgery. The truth is, sciatica is not a diagnosis, it is a symptom. And treating it like a single problem is why so many people stay stuck with pain. In this video, you will finally understand what sciatica actually is, what causes it, which symptoms matter and which ones do not, and why so many common treatments fail even when the pain feels severe. And I will walk you through the exact 3-step treatment approach we use in our clinic that has helped hundreds of sciatica patients recover fully and return to normal life. You will see how inflammation is calmed, discs are supported as they heal, and nerve pressure is relieved without daily medication or rushing into surgery. Keep watching. Hi, I'm Dr. Cordova, a chiropractor in Houston, Texas, with 29 years of experience helping people with chronic neck pain, back pain, poor posture, and sciatic nerve irritation. As a chiropractor, I believe the adjustment is the most powerful thing we do, and being specific with it matters, which is why I rely on spinal x-rays to guide every patient's care. On this channel, you'll get simple, specific, and safe strategies you can use at home to feel better fast. I share the same x-ray guided chiropractic strategies, posture fixes, and modern therapy insights I use in my clinic to help my patients get long-lasting relief. Subscribe to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. If you are dealing with sciatica, the pain can feel intense and unpredictable, especially when no one has clearly explained what is actually causing it. The good news is that in most cases, sciatica is far more treatable than people are led to believe. In this video, I will clearly explain what sciatica is, why the pain behaves the way it does, and how different structures in the body can create the same symptoms. When you understand the real source of the pain, fear drops and decision-making becomes much clearer. By the end, you will have a better understanding of what your symptoms mean, which treatment options make sense, and why some approaches only provide short-term relief. To do that, we first need to get clear on what sciatica actually is and why the pain travels the way it does. To understand sciatica, you first need to understand why the pain does not stay in your back. The sciatic nerve is the largest nerve in the body, formed from the spinal nerves in the lower lumbar spine and the sacrum. The sciatic nerve travels through the buttock, down the back of the thigh to the knee, and then branches out into the other peripheral nerves that run all the way down the leg to the feet. When the spinal nerves that form the sciatic nerve become irritated or inflamed, your brain feels the pain along the path of the nerve, not just where the problem begins. Here's a simple way to picture it. Imagine stepping on a garden hose. The problem is at the point you step on it, but the water pressure changes all the way down the hose. Sciatica works the same way. When irritation might be in the lower back, but pain shows up in the hip, thigh, calf, or foot. That is why people are often confused when their leg hurts more than their back. This is also why sciatica feels different from person to person. Some people feel sharp pain. Others feel burning, tingling, or numbness. Some days it moves. Some days it fades. That does not mean the condition is unpredictable or dangerous. It means the nerve is reacting to pressure or inflammation somewhere along its origin. Sciatica is called a symptom because the nerve is responding to something else. Most commonly, disc irritation, joint issues, or inflammation around the nerve. Until you identify what is irritating the nerve and where that irritation is coming from, treatment becomes guesswork. That is why the next step is understanding the most common causes of sciatica and why more than one is often involved at the same time. Sciatica usually does not come from one single issue. In most cases, several problems are happening at the same time, which is why the pain can feel persistent or unpredictable. Understanding these causes is critical because each one affects the sciatic nerve in a different way. Before breaking these down, it helps to understand that sciatica can be triggered in several ways. Some causes originate from changes in the spine itself, others come from how the spine and pelvis move and carry load, and some come from irritation along the path of the nerve. These are the most common contributors we see clinically, and they often overlap rather than occur on their own. Number 1, disc involvement. One of the most common causes is disc involvement. When a disc bulges or herniates, it can place pressure on the spinal nerve or create chemical irritation around it in the form of inflammation. This does not always mean the disc is severely damaged. Even mild disc bulges can cause significant nerve symptoms, especially when inflammation is present. The most common disc-related sources of sciatica leg pain occur at the L4, L5, and L5, S1 levels of the spine. Disc bulges, protrusions, and herniations at these levels are especially likely to irritate the nerve roots that form the sciatic nerve, which is why pain often travels into the hip, thigh, calf, or foot. Number 2 is narrowing around the spinal nerve, or foraminal stenosis. The sciatic nerve roots exit the spine through small openings called neuroforamen. Over time, those openings can narrow due to disc collapse, arthritis, or bone changes. When that space decreases, the nerve can become irritated even if no large disc herniation is present. When this narrowing affects the nerve roots that form the sciatic nerve, it commonly produces sciatica leg pain that travels from the low back into the hip and down the leg. Number 3 is spinal misalignments and joint dysfunction. Joint and structural issues are another major contributor. When the joints in the lower spine are not moving or aligned properly, they can change how pressure is distributed through the spine. Over time, this can reduce space around the nerve and increase irritation, even without a disc problem. When this type of joint dysfunction irritates the nerve roots that contribute to the sciatic nerve, the pain is commonly felt traveling from the low back into the hip and down the leg. Number 4 is pelvic or sacroiliac joint involvement. Misalignments in the pelvis or sacroiliac joints can also contribute to sciatica. These joints influence how force travels through the lower spine and hips. When they are restricted, tension can increase along the path of the sciatic nerve, leading to leg pain that does not respond to typical back treatments. Number 5 is muscle-related nerve compression. Sciatica can also come from outside the spine. Tight or overactive muscles in the hip, especially the deep rotators like the piriformis muscle, can compress the sciatic nerve as it passes through the pelvis. This explains why some people have classic sciatica pain even when imaging of the spine looks relatively normal. Number 6 is inflammation and nerve sensitivity. Inflammation often ties everything together. Irritated tissue around the nerve can amplify pain signals and make symptoms more intense and widespread. This is why sciatica can feel worse after sitting, bending, or long periods of inactivity. These are 6 common causes of sciatica. It is important to know that these causes rarely exist on their own. A disc issue, joint dysfunction, muscle tension, and inflammation often overlap, which is why addressing only one factor usually leads to temporary relief. One of the most confusing parts of sciatica is how differently it can present. Some people feel sharp or shooting pain, while others experience burning, tingling, or numbness. The pain may be felt in the hip, thigh, calf, or foot. Even though these symptoms feel different, they can all come from irritation of the sciatic nerve. It is also normal for symptoms to change. Pain may move along from the leg or vary from day to day. This does not automatically mean the condition is getting worse. In most cases, it reflects changes in pressure or inflammation affecting the nerve. What matters most is the pattern, not just the pain level. Symptoms that travel down the leg, worsen with certain movements or positions, or include numbness or tingling are typically signs of nerve involvement and help guide proper evaluation and treatment. Some symptoms create unnecessary fear. Mild weakness or stiffness or fluctuating pain can occur with nerve irritation and during recovery. However, persistent or worsening weakness or changes in bowel or bladder control should always be evaluated by a healthcare professional. There are many different treatment options available for sciatica leg pain. Physical therapy, targeted exercises, acupuncture, medications, injections, and in some cases surgery can all play a role. When these approaches are used at the right time and matched to the underlying cause of the nerve irritation, they can be helpful for the right patient. However, when these treatments are used on their own, without addressing the other factors involved, the results are often incomplete. Symptoms may improve for a while, but the pain frequently returns because only one part of the problem was addressed, not the whole issue. When you understand that sciatica is a symptom, it explains something many people experience. Relief comes and goes, but the pain never truly stays away. That happens because most treatments focus on just one piece instead of the full picture. Medication is designed to reduce pain signals or inflammation, but it does not change what is putting pressure on the nerve in the first place. Injections may calm inflammation temporarily, but if the structure around the nerve stays the same, the symptoms usually return. Even rest can feel helpful at first, yet as soon as normal movement returns, the pain often follows. Another common issue is lack of precision. Generic treatments that are not guided by imaging or proper evaluation can miss the true source of nerve irritation. If a disc is involved, if a joint is misaligned, or if inflammation is driving the pain, each requires a different approach. Treating everyone the same leads to inconsistent results and a lot of frustration. This is why so many people are told they have tried everything, when in reality they've never had all the contributing factors addressed at the same time. Sciatica rarely has a single cause, which means lasting relief usually requires more than a single type of treatment. That is why the next step is understanding what it looks like when structure, disc pressure, and inflammation are all addressed together in a coordinated way. In my experience treating sciatica patients for over 29 years, I have found that the most reliable and lasting results come from combining specific treatments that address structure, disc pressure, and inflammation together. Rather than relying on a single approach, we use a stacked, multimodal treatment protocol designed to correct the underlying causes of sciatica, not just manage the symptoms. The first component is chiropractic adjustments. These focus on restoring proper movement and alignment in the joints of the spine. When the spine moves the way it is designed to, abnormal pressure on the nerves is reduced and the nervous system can function more efficiently. When adjustments are guided by spinal imaging, they become more precise and predictable, which helps create a stable foundation for healing. The second component is non-surgical spinal decompression. This therapy is designed to reduce pressure within the spinal discs, which are a common source of nerve irritation. By gently unloading the disc and creating space around the nerve, decompression helps improve fluid movement, reduce disc pressure, and support the healing process. This is especially important when disc bulges or disc degeneration are contributing to symptoms. The third component is pulsed electromagnetic field therapy, or PEMF. PEMF works at a cellular level to calm inflammation and support tissue repair. When inflammation is reduced, nerve sensitivity decreases and healing becomes more efficient. This helps the body respond better to both adjustments and decompression rather than fighting against ongoing irritation. When these three treatments are combined, they work synergistically. Adjustments improve joint mechanics and alignment, decompression reduces disc and nerve pressure, and PEMF supports recovery by calming inflammation and promoting healing. Together, they create an environment where the sciatic nerve can recover more completely, which is why many patients experience more stable, long-term relief rather than short-term improvement. You now understand what sciatica is, why the pain travels down your leg, and why treating only one part of the problem often does not last. More importantly, you know that sciatica is usually very treatable when the underlying causes are identified and addressed correctly. If you have been dealing with sciatica, leg pain, and the treatments you have tried have not worked, do not lose hope. Many people improve once care is focused on restoring spinal movement, reducing disc pressure, and calming nerve irritation. Look for a chiropractor in your area who has experience treating chronic sciatica using chiropractic adjustments, non-surgical spinal decompression, and pulse electromagnetic field therapy. If you found value in this video, please like it and share it so others dealing with sciatica leg pain can get clear, accurate information instead of fear and confusion. Now it is your turn. What treatments have you tried for sciatica leg pain? What helped and what did not? Leave a comment below and let me know. I read every comment. And be sure to subscribe to the channel if you want to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable tips you can use right away. The next video you should watch is this one if you want 5 simple exercises that can help calm leg pain quickly. Go watch that video next.